Welcome to a presentation of the California Early Start State Systemic Improvement Plan, or the SSIP. This presentation was developed by the Department of Developmental Services and with support from the California Department of Education, WestEd's National Center for Systemic Improvement, and the Early Childhood Technical Assistance Center. The goal of this presentation is to provide an orientation for early start stakeholders and others on the basics of the SSIP. This presentation will cover a variety of topics related to the SSIP, including a brief overview of the Early Start program, background information on the SSIP, what the SSIP is, California's State Identified Measurable Result, or SIMR, key messages of the SSIP, the SSIP improvement activities, implementation phases and resources, the role of local implementation teams, expected outcomes, and next steps. Part C of the Federal Individuals with Disabilities Education Act, IDEA, covers all state early intervention programs for infants and toddlers aged birth through 2 years. In California, that program is known as Early Start. DDS has been designated as the lead agency responsible for the administration and coordination of the statewide service delivery system. In other words, Part C is what gives DDS the authority and direction to administer the Early Start program in California. In 2014, the United States Department of Education announced a major shift in the way it oversees the effectiveness of states' early intervention and special education programs by moving from compliance to compliance and results based on outcomes for children with disabilities. This means that rather than ensuring that states simply meet the program requirements identified in regulation, each state must also focus on improving outcomes for children and their families. As a result of this shift, each state was asked to develop its own State Systemic Improvement Plan, or SSIP. The SSIP itself is a comprehensive, ambitious yet achievable multi-year plan for improving results for children with disabilities. The SSIP represents a brand new reporting component, or indicator, of the annual performance report, which all states must submit each year to the Office of Special Education Programs, or OSEP. OSEP added the SSIP to the APR to help states focus on child outcomes. States were instructed to analyze their child and family outcomes data, existing infrastructure, and their ability to enhance this infrastructure to increase the capacity of local early intervention programs, all in order to improve outcomes. In California, the SSIP was developed with help from early start stakeholders, including parents and providers, and staff from regional centers, family resource centers, and local education agencies. Support was provided by staff from the Department of Developmental Services and the California Department of Education. This task force has assisted the department at each phase of the SSIP. The SSIP takes place in 3 major phases, each with their own activities. We will be reviewing these phases and their activities in more detail in the following slides. Phase 1 of the SSIP was the analysis phase. The main goal of this phase was for states to select an area of child or family outcomes upon which to focus their improvement efforts. This focus area is known as a State Identified Measurable Result, or a SIMR. We will be talking more about California's SIMR in a later slide. To help select a SIMR, states explored the existing issues, initiatives, and infrastructure, and looked at child and family outcomes data to gather information about program performance. Phase 1 also involved the development of broad improvement strategies, or ways that states could plan to improve outcomes in their chosen area. States also built a theory of action, which illustrates how the proposed strategies will impact providers, families, and children with disabilities in order to improve outcomes. California's Phase 1 report was completed and submitted to OSSIP on April 1st, 2015. In Phase 2, states were tasked with developing their multi-year plan to address how the state will implement needed system improvements to enable the state to build the capacity of early intervention programs and providers to implement and scale up evidence-based practices, support early intervention programs and providers in identifying and implementing the evidence-based practices that will result in changes in practice to improve results, and evaluate the implementation of the SSIP. California's Phase 2 improvement plan was submitted to OSSIP on April 1st, 2016. In Phase 3, states are required to report on the results of their ongoing evaluation of the strategies included in the SSIP, including the extent to which the state has implemented them, the extent to which the state has made progress toward and/or met the established goals, and any revisions the state has made in the SSIP in response to its evaluation. Submission of Phase 3 information will most likely include child outcomes data on the APR, as well as a description of ongoing evaluation efforts and results. Phase 3 reports will be submitted yearly in February through 2020. However, efforts initiated during Phase 3 of the SSIP are designed to be sustainable so that improvements in results will continue long after this time. Earlier in this presentation, we mentioned that each state was required to choose a specific child outcomes area to focus on and develop a plan to improve said outcome area. This is called the State Identified Measurable Result, or SIMR. After reviewing California's Early Start data and infrastructure, Early Start stakeholders, in partnership with staff from the Department of Developmental Services and the California Department of Education, chose to focus on social-emotional outcomes for the SSIP. Specifically, they chose to increase the percentage of infants and toddlers with disabilities in California who will substantially increase their rate of growth in positive social-emotional skills, including social relationships, by the time they exit the early intervention program. So why focus on social-emotional development? One reason is that California has room for improvement in this area. Overall, California does very well in a lot of outcome areas. However, the SSIP is specifically about identifying opportunities for improvement. In this specific area, California falls several percentage points below the national average. In Phase 1, social-emotional development was identified by Early Start stakeholders as an opportunity for growth. More importantly, social-emotional development was identified as important because it is the basis for learning for all other developmental domains. Research shows that healthy social-emotional development sets children up for success later in life. Social-emotional competence is also shown to be a key factor in helping families be healthy and thrive. The parent-child relationship is key to social-emotional development, and families of children with special needs require extra help to build this relationship. The importance of the parent-child relationship is already central to Early Start, and as such, there is already foundational knowledge in our program about how to support families to improve the child's development, including the social-emotional domain. Research has shown that family-based early intervention services, like those promoted by Early Start, have a variety of positive effects on children's growth. As a result of family-based services that focus on social-emotional development, children are able to be more easily comforted, pay more attention to what is going on in their surroundings, better regulate their emotions, learn they can influence others through their actions, and develop more secure attachments to their parents or other caregivers. The goal of the SSIP is to support the existing efforts to help families develop strong relationships with their children with special needs, and therefore improve social emotional development of early start infants and toddlers. In order to achieve our state-identified measurable result, the SSIP team developed a theory of action that linked our desired outcome with 3 broad categories of activities that will take place during the SSIP. These categories, or strands, represent 3 areas that we felt we could have the largest impact on in our system. The 3 strands in question are parent-provider education, professional development, and interagency collaboration. The resources that DDS has developed in conjunction with its partners are meant to specifically support these individual strands. In support of each strand, Early Start stakeholders developed a number of improvement activities which will take place at the state and local level. With regards to the first strand, parent-provider education, these activities are designed to help support parents and providers to receive the education and training they need to make a positive impact on social emotional development. The first activity under parent-provider education is the Take a Minute campaign. This includes the development of a brochure for service coordinators to review with families at each IFSP meeting that emphasizes the parent-child relationship as key to healthy social emotional development. It also includes a video for providers and parents to refresh them on the tenets of family-centered practice and the importance of the parent-child relationship in social emotional development. The second activity under parent-provider education is a service provider checklist on family-centered philosophy best practices. Service providers will be given a tip sheet of best practices in family-centered service provision, including reminders such as, are you coaching the parent during the session? And are you considering the family's routines when you are developing your intervention strategies? One of the activities under the professional development strand is aligning existing trainings with the service provider competencies on social and emotional development that can be found in the Early Start Personnel Manual. DDS and its partners at the West Ed Center for Prevention and Early Intervention have also created an online community of practice, which houses all SSIP-related trainings and materials, and is a place for professionals of all disciplines to collaborate and share resources and best practices. Another activity under professional development is the modification of existing training modules on social emotional development. Modules that are currently offered through West Ed's Early Start Online that pertain to social emotional development will be modified to be shorter and accessible to more trainees. Trainings and materials will be made available online through the community of practice, which will be open to all staff, parents, and providers who are participating in local implementation of the SSIP. Finally, the interagency collaboration strand involves the following activities: the development of a resource guide on statewide initiatives addressing social emotional development, the issuance of a paper on guidelines around evidence-based social emotional assessment, and the promotion of the Take a Minute campaign. DDS, in partnership with the Interagency Coordinating Council, or ICC, has developed a resource guide containing free materials and resources for California's statewide initiatives focusing on social emotional development. Local implementers will choose an evidence-based initiative that focuses on social emotional development and incorporate those free resources in their communities. Local implementation teams are also welcome to leverage and scale up existing initiatives in their areas that are implemented by any of their local partners. The ICC has also developed a paper to provide guidance to the field on evidence-based evaluation and assessment practices in order to support the determination of eligibility, the development of the IFSP, the monitoring of progress, and the accurate reporting of child outcomes. Additionally, the ICC will adopt and promote the messaging of the Take a Minute campaign to statewide partners and stakeholders. In order to implement the SSIP activities at the local level, each regional center catchment area has developed a local implementation team consisting of representatives from the regional center, family resource center, local education agency, and other community partners such as First Five, Early Head Start, and the County Office of Mental Health. Each year of implementation will involve 4 to 7 local implementation teams participating in the SSIP activities described in previous slides. These 4 to 7 implementation teams will be grouped together as cohorts. Implementation of the SSIP will take place statewide over the course of 3 years or phases. In the first year, which started July 2016, the first innovative zone of 4 to 7 local implementation teams started their participation in SSIP activities to improve outcomes for early start infants and toddlers in their catchment areas. The following year, 4 to 7 additional teams will begin participating, and in the final year of the SSIP, the remaining local teams will be participating. Throughout the SSIP, local implementation teams will receive assistance in a variety of ways from DDS and West Ed. Each team will be assigned a staff member from DDS who will serve as a liaison to provide support and technical assistance. Staff from DDS and the West Ed Center for Prevention and Early Intervention will also be present in the online community of practice to provide ongoing support to local programs who are participating in SSIP activities. So what can local implementation teams do to support the SSIP and help improve the outcomes for early start infants and toddlers? There are many ways that local implementers can participate. Regional centers, family resource centers, and local education agencies can make the SSIP materials, videos, and trainings available to the community by posting links and resources to their website and encouraging service providers, parents, and support staff to participate. Parents and providers can participate in the trainings that will be made available in the Early Start community of practice. Local implementation team members can take advantage of the many opportunities to receive technical assistance from DDS and West Ed. And local implementation teams can provide guidance on participating in the SSIP to implementation teams in future cohorts. There are many resources available to local implementation teams to help support their SSIP activities. DDS Early Start staff will be available for support and technical assistance. West Ed Center for Prevention and Early Intervention will be developing and delivering trainings through their comprehensive system of personnel development and hosting the online community of practice, as well as providing support and technical assistance. The Interagency Coordinating Council will develop a resource guide on initiatives that focus on social-emotional development to help local implementation teams choose evidence-based practices that will improve social-emotional development for early start infants and toddlers. Finally, fellow members of local implementation teams will provide peer mentoring and share best practices and ideas for participating in the SSIP. Each regional center will develop an implementation plan detailing how they will work with local partners to utilize these resources to support each of the previously mentioned strands. By supporting our local implementation teams in the completion of the previously mentioned improvement activities, it is our hope that families will receive the support and education necessary to support social-emotional development in their own homes. Service providers will competently and consistently implement evidence-based practices that support the parent-child relationship. And service coordinators will have the tools they need to support parent-child relationships. According to our theory of action, by accomplishing each of these strands, infants and toddlers will increase their rate of growth in the social-emotional domain. This concludes our presentation. We would like to acknowledge and thank the following partners for their help in developing this presentation: the California Department of Education, WestEd's National Center for Systemic Improvement, and the Early Childhood Technical Assistance Center. Thank you for listening and learning about California's State Systemic Improvement Plan. We look forward to working together to improve the lives of early start infants and toddlers and their families.